If you have a student athlete, then you know a physical might be required for them to play sports. Our next guest wants to make sure the right tests are being performed and the right questions are asked. The reason why LeBron James' son, Bronny, had a cardiac arrest was because of an unknown congenital heart defect. In most cases, a defect can be treated, but don't wait because a cardiac arrest can be deadly. Joining us with how to avoid that issue and what symptoms should bring you in for a checkup is Pediatric Cardiologist Dr. Quinones with the Heart and Vascular Institute. Good morning.
Good morning.
All right, let's first clarify heart attack versus cardiac arrest. I know a lot of people use them interchangeably, but they're different in the physiology. Right?
Yes, so the heart is a muscle, and so it needs oxygen and blood, and it does that through coronary arteries. If there's a blockage of one of those coronary arteries, that's what we would consider a heart attack. Yeah. Much more common in the adult population than the pediatric.
Because it had time for those blockages to form, right?
Exactly.
All right, cardiac arrest can usually come with no warning. That's why it catches everyone by surprise. And even when you see like an athlete, you know, like LeBron James' son, you're thinking they're at the height of health. And then it's also so public that people are like, wow. So it brought a lot of attention to that.
Yes, so a cardiac arrest can be due to structural or electrical issues, and it can happen out of nowhere. The warning signs can be quite subtle, so it is important to get screened.
Yeah, who's susceptible?
Particularly those with family history, but if your child's exhibiting signs of chest pain with exercise, shortness of breath, not being able to keep up with peers or what they used to do, those could be signs that something could be looming.
Yeah, all right. So some children, in fact a lot, are diagnosed at birth with a congenital heart defect. About 40,000 babies each year are born with a heart defect, but others it may be missed or misdiagnosed.
Correct. So the signs can be subtle, and luckily there are milder congenital heart disease, but that also means that they can be harder to detect and not show up until years or even decades later.
Yeah, all right. And then there's that part of the actual structural defect, but then that electrical part, that's the one that is kind of harder to predict?
Yes. The signs can typically be racing heart rate out of proportion to what you're doing, palpitations, dizziness out of proportion to what you're doing can all be a sign that your heart's electrical system might need some investigation.
All right, preventative cardiology. So some blood pressure regulation, all those types of things can help?
Yes, so I'm quite passionate about preventative cardiology, particularly in the pediatric population. Yeah. So it is important, especially if you have family history of high blood pressure, high cholesterol, to have your child checked with your pediatrician. And if there are concerns, seeing a specialist like a pediatric cardiologist can help manage those so that your child stays healthy for a long time.
So we have the sports physicals. I remember going through it as a kid, but it wasn't very much that I went through, and they've done it with my son. So does the average sports physical look for something like a congenital heart defect?
So they will screen for the larger defects. The pediatricians have a lot of things to check to make sure that your child's overall health is well, and the cardiac aspect is part of it. But there are times when a child can pass a typical screening sports physical and something be wrong, much like Bronny James, who is very healthy appearing. So if you have any concerns whatsoever, it's worth investigating.
All right. You talk about being very passionate about this. You all at Modern Heart and Vascular are passionate about a number of things. You're involved in the community in a number of ways. You have your annual Dash and Bash fundraising event.
Yes. So we try to get out into the community as much as possible, trying to interact and spread education as much as we can.
Yeah. All right. So you're dealing with pediatrics, but Modern Heart and Vascular has been on the show several times. You'll deal with, you know, not only pediatrics, but mom and dad, grandparents, great-grandparents, if you got some great-great-great-greats, you'll deal with them too. But it's everything that deals with the heart and, of course, the vascular system.
Yes, correct. So being a pediatric cardiologist, I'll see birth till 18, and my colleagues who do adult medicine will go until great. So we can see anybody.
Are we seeing younger and younger people with heart issues?
In today's population, yes. The lifestyle, the food, particularly through COVID, where a lot of people didn't get out and do those heart-healthy activities, we are seeing a lot more pediatric patients with heart concerns.
Wow. And then, of course, with COVID, we're seeing the impact that COVID had on some younger people, right?
Yes, COVID and other viruses have been known to cause cardiomyopathy and other cardiac concerns.
The number one killer around the world is heart disease
Yes,
for
it
men
is.
and women. I know all the times people think that that's the man's disease, but no, men and women around the world. What's the top things people can do? Because we always think there's going to be a warning. Like our body's going to say, hey, next month you're going to have the heart attack, so get in, right?
Yeah.
But what's the number one thing we can do to be proactive? I think there's probably a lot more that we can do as patients than we think we can. A lot of times we come to you and say, here, fix it, doctor.
Yes.
But there's a lot more we can do to be partners in our own health.
Yes, so just being aware and listening to those warning signs. I know a lot of people are really good at making excuses and putting off your health, but making sure that you are in tune with your body, getting good sleep, good exercise, and eating good food. It's the simple things, but they're the most difficult.
Yeah, all right. And you say, listen to those warning signs. A lot of times there are no warning signs, or we don't think so. We look back and we go, oh, that's
Correct.
why I was having the shortness of breath, or that's why I was, yeah.
So that healthy lifestyle of sleep, exercise, and food are very, very important.
Yeah, can't get around it. It's not in a pill, is it?
No,
All right.
ma'am, not yet.
Dr. Quinones, thank you so much. Modern Heart and Vascular Institute is seeing patients of all ages, kids, parents, grandparents, great-grands, and they have a special offer. If you have questions or concerns about your child's cardiac health prior to participating in sports, you can obtain a baseline EKG at their Humble office on June 20th, but you must schedule a screening by June 14th. To book an appointment with a board-certified cardiologist, visit them online at modernheartandvascular.com or give them a call at 832-644-8930. Again, that's 832-644-8930. They deal with all issues of the heart, and they also deal with, as you've seen on this show several times before, vein disease as well.